A big announcement from the mayor of the Big Apple. He's put New York City's private sector employees on notice that their workers must get vaccinated against COVID-19 before the end of the year. BNC's Dray is in New York with more.
New York City's Mayor Bill de Blasio says the city's decision to implement newer and tougher vaccine mandates is a preemptive strike, as the city is now concerned about the Omicron variant spreading across the city and leading possibly to the kind of restrictions and shutdowns we saw in 2020. He says the only way to stop that from happening is for more people to get vaccinated, and so these new mandates are both vital and necessary. New York City is now first in the nation to mandate all employees who no longer work remotely at private companies be fully vaccinated by December 27th.
We're going to be talking to them in the next days on how to put together the right plan to implement this.
184,000 businesses are on the list. The city is now setting up call centers and launching outreach efforts to address questions and concerns.
Vaccination works and vaccine mandates work. That's the bottom line.
The mayor also announcing today that children between the ages of 5 and 11 will now be required to have at least one dose of the vaccine by December 14th if they participate in high-risk extracurricular activities like indoor sports, or if they want to sit down inside movie theaters and restaurants.
Case rates are currently highest among our 5 to 11-year-olds. But we can change this, and indeed, parents have already vaccinated over 130,000 kids since 5 to 11-year-olds became eligible.
The same vaccine mandates have already been in place for everyone 12 years and older. Meanwhile, 94% of city workers are vaccinated. The goal is for the private sector to accomplish what the public sector already has.
There's not a testing option as an alternative, and anyone who is unvaccinated would need one dose by December 27th.
The mayor says the city has to take aggressive and bold action as the new Omicron variant reaches the city. So far, of the 8 cases of Omicron already documented in the state, 7 are from the New York City area.
And you can expect, and I'm sorry to say this, you can expect community spread. We have to assume it's going to be widespread. We have to assume it's going to give us a real challenge.
At least 16 states around the country have reported Omicron cases. And with the cold weather and holiday gatherings on the way, more people could become sick. Vaccination is the best defense against widespread transmission, de Blasio says. Otherwise, another period of restrictions and shutdowns could be in the city's future.
We are not going back to what happened in 2020. We cannot allow that to happen.
Hank Newsom, co-founder of the grassroots nonprofit Black Opportunities in New York City, has raised concerns about vaccine equity in Black and brown communities. And he now takes issue with how the city is ordering people and not asking them to consider taking the vaccine.
I don't want to see more Black people die as a result of COVID, and I would love to see this virus contained, but I'm anti-mandate. You know, you can take the vaccine if you want to. I am anti-mandate and I am not anti-vaccination.
City leaders say they expect some companies to file lawsuits challenging these new vaccine mandates, but they believe they have good legal standing to make these changes because it's a community health issue that could be both costly and deadly. In New York, I'm Dray Clark for Start Your Day.
You know, with all due respect to the brother in the peace, you know, and people have a right to say, use your, this is what you want to plant your flag, stake your claim to, this is what you really want to do, okay, I guess. Because the fact is, you can't tell me, well, I guess you could. He said, I don't want to see more black and brown people die, right? Something like that is what he said, am I right? But they are. Okay? And here's why. I'm not going to. They're dying because they're, by and large, not vaccinated. What I try to break down as many syllables as I could. What don't you understand about that? So if you really don't want to see Black and brown, stop staking your flag and planting it on this mountain of, well, people should have the right to do what they Why don't you? We've been asking them, brother, where have you been? Hibernating? Winter hasn't even started yet. We've been asking them, okay? I start by asking my daughter to wake up. Please get up. Good morning. Hi. I love you. I'm so proud of you. Can you wake up? 15 minutes goes by, you're still snuggled under the covers. So now I dim the lights up. I turn them on. If I come back 15 minutes later, I have to get more aggressive with it. Get up now. If I come back after that, you're going to lose something. That device you love so much. Get up. Get vaccinated. Stop. What are you? This is all semantics. It's semantics.
Yeah. It is. You kind of triggered me a little bit because you took me back to my childhood when if I was asleep, my mom told me to wash the dishes, take out that trash.
Oh,
she would tell me nicely, hey, Michael, take. Second time, a little bit, more stern. Third time, Michael, I'm not going to tell you again. The fourth time, the sheets came snatched off my bed. I was ripped out of bed, and there was no device taken away. It was It was. She did not spare the rod.
And you're like, what happened?
All
you
of that.
Sleep.
So you're 2, 3 o'clock in the morning. So here's to break that down. There's a threat that's going to come your way. And what people need to understand, I think this is the big issue that people have in this country, is that they don't like being told what to do. Let's just be honest. I don't like the government telling me what to do, right? Here's the problem with that. They tell you what to do when it comes to you putting your seatbelt on to save your life. The difference in you wearing a seatbelt to save your life, may not kill somebody else in another car, but in this situation right here, the reason why they have to mandate is because they've asked you nicely. You have not listened. Nobody wants to get it done. You're still being hesitant about this, but your decision, now listen to me, your decision affects others. That is the reason why it has to be mandated, because it's not just about you. So even if you get COVID-19, it may not have any effect on you. You may be asymptomatic. You may be able to live your best life. But you could pass that along to a little old lady who may have even had her vaccination, but she has an underlying condition. And you just breathe on her just a little bit. You could kill her. You could kill her.
Yeah, no.
That's what people don't understand.
Yeah.
I don't want to make sure I whisper it instead of yelling, because I'm tired of it. That's what people need to get. It's smoking cigarettes, harmful to your health. Nobody can mandate and say you can't smoke cigarettes, but they can tell you take your outside. And then when people walk by, yes, there's a possibility for them to get cancer from secondhand smoke from walking by, but you can't blow it in their faces. You can't. What I don't understand, that's what this is what's frustrating about the whole situation. Look, we have asked you to do it. Now we're saying, okay, you need to do it because your decisions, once again, Sharon, are affecting others and other people are dying. We have not gotten past this pandemic. People are still going to the hospital at a higher rate than we did last year.
Yeah.
And these new variants that are coming out, we don't know how harmful they can be. I don't get it. I don't get why they don't get it. But that's just the way that we live in this world, the world we live in today.
Hard-headed, I guess. We don't have to use the little old lady scenario. Colin Powell is dead. Let's use the 5-star general. Let's use the Secretary of State real life scenario. He's dead. And we have Omicron. Stop coming up with these cute little dumb names. We'll just call it Death March 1, 2, 3. However many chapters you need. It's a death march. And it's here, Omicron, because of people like the brother in the piece. I'm sorry, okay? I'm sorry. Because of people like him. I submit to you, I don't know him, I can't remember his name, but he's fully vaccinated with a bunch of things. Because why? It was mandated. Why? He went to school. So cut this. Stop it about people in free. I'm a libertarian. Get out of here. Okay? Liberate this. Get vaccinated. It's mandated, just like a bunch of other measles, all kinds of stuff. If you want to go to school, if you want to do this, if you want to go here, that's what it is. So stop sitting here being so self-righteous, pretending that you care about black people when you're telling them, well, I think we should ask them. Okay? I could ask you a lot of things.
Yeah.
But this one is, I'm telling you to get up. Period.
Right, right. Because you're not only missing the
don't you
bus
understand?
like Ava would, everybody else is going to miss the bus too, and they're going to
I'm
pay
not
for it
taking
as
you.
well.